healthcare systems just like to put fear in you. So what I have in me is the latest report released by the Ministry of Health sent to WHO in regards to dengue. And you know, there are 66,000 people more who have had dengue this year alone in this country, and 102 people have actually died. How come this is not reported every day in news? How come this is not an issue? So they are very clever in actually disseminating fear tactics. So whatever you fear, they're going to pump that. So to say that public health is doing a fantastic job, yes, but it's just a tactic of disseminating fear all this while. So if dengue is such a problem, how come we never actually did something at all? How come there was never an issue? Because it's an epidemic, it's not a pandemic. But what are we doing locally? Because the numbers are still high. There's still many people dying. There's no vaccine for dengue. None of the PBTs or the municipal councils have actually called and encouraged people to do massive gotong royongs to clear up their hood, to make sure the places are clean. No, this is never done. Is it because we can actually give out free contracts to actually spray diesel and aerosol to combat dengue? These are the things that I start wondering that how good public healthcare systems are. In fact, to tell you that public health systems has actually failed long time ago. They failed to combat non-epidemic issues, failed to combat sugar, failed to combat diabetes, failed to combat hypertension, failed to combat heart disease, and all that they fund is tertiary healthcare, get more surgeries done, get more medications out. That is what they always do. And if you start thinking about the numbers, again, 70 to 80 million people die in the world. And if it's COVID, it's going to be a big issue. I think we get real, because until maybe this week, probably we're going to have about 800,000 people dying because of COVID. So these numbers don't justify that this is such a scary issue. I still feel that you as a lawful citizen abide to whatever what rules they have, whether it's wearing masks, protective hand sanitization. These are basic things that you can still do to reduce all kinds of diseases from spreading, not just COVID-19. But the thing is, they have already placed immense fear in your brain that you are paranoid. And what would public healthcare do when the economy crashes? What would public healthcare do when there's a lot of people having depression or other kinds of illnesses thanks to this miscall shot? I feel now it's gone overboard. Maybe at the early stage of preventive care, it's done, it's well, but now it's taken too much of a drama. That's what I got to say. But you guys, if you still are a citizen of any country in the world, please follow the rules of law and order. Ciao.